Hello, hello.
Hello, Aditya.
Hello, Adnan. Hello to our attendees as well.
I love your summer look. You're already there. I love it.
Uh, you know, it was 85 and it felt like 115 yesterday in Dallas, and today it's 70 and tornado warning. So lovely day in the South. How's it in California?
It is a lovely day. It is 70 degrees. So light breeze. Can't complain. We're wusses here.
I know, as a many decade Californian, this is a transition. For those who don't know, welcome to Digital Health on Air. My name's Aditya, a recent Texas transplant. I'm joined by my partner at Luma Health, Adnan. Go ahead.
And down here, one of the founders and CEO at Luma, and a San Francisco Bay Area native, California native. So that's the fun fact.
Clearly a huge weather win. And while we're at it.
Huge weather win. 100%.
So in today's episode of Digital Health on Air, we're going to be just talking, myself and Adnan here, a little bit on kind of what's current in digital health across the landscape. If you've been a longtime listener to our very short new web series, you would have learned at the very beginning when we introduced the show, Adnan and I are going to come on from time to time, talk about what's hot, topical, interesting, and just things that we hear from being out on the road with CIOs. Like, in fact, this morning I was at the Dallas HIMSS event at the Gaylord Texan, and one of the main things that came up from a panel I was listening to was cybersecurity. So, I mean, Adnan, you talk a lot about how CIOs often, this is one of the big topics for them. So, there's been a lot of cybersecurity the last couple of months.
Yeah, absolutely. I think a lot of things make the startup news and the investment news and all things kind of the patient will see you now and all these kind of sexy buzzwords. But the reality for CIOs, CTOs, health systems writ large, and really if you think about just companies and technology companies as a whole, security is the top of the list, right? And for good reason. Obviously, we just in the past couple of months we see Change Healthcare, Ascension, Phreesia. So cybersecurity is top of mind. Cybersecurity should be top of mind for everyone. All of us are at risk. Healthcare is no different than any other industry. If we think back to last summer, MGM was making the deep, right? Where talk about
I can't gamble. Slightly less serious. I can't
get in my room. Can't get an elevator, right? So security risk at scale. And I think you and I were fortunate to hear a cybersecurity expert speak earlier I guess it was last fall, that this is real. It's getting smarter. It's getting better. It's obviously AI enabled, like everything else in our lives. And it is well coordinated and well orchestrated, and different people do it for different reasons. And so healthcare has the same risk. I think healthcare, of course, has, it's in the unfavorable position of this is incredibly valuable data, right? Like stealing MGM's data, like bad, you can lock people out, you can do unsavory things, but my healthcare data, your healthcare data, our kids' healthcare data, very, very, very sensitive, right? And so that's where we understand why this is top of mind for CIOs. And I think we should all acknowledge, like, healthcare hasn't been the fastest adopter of technology, right? With the technology companies, your Microsofts, Googles, pick one, are doing in terms of securing their data. Healthcare just isn't quite there yet, but the risk here, given
the risk is magnitude times a million, right?
Single bank.
One of the really interesting, I was mentioning, I was at Dallas HIMSS chapter event earlier today, and there's this really practical piece of advice, and I love that kind of really practical, like, it's like news you can use. What can I do with this information outside of just being like scared and putting on my tinfoil hat? He was mentioning that he's the CIO of University of Texas Medical Branch. And he was mentioning that they actually recently licensed a dark web scanning technology, and they found MyChart credentials like on the dark web of their patients. So one of the interesting things that I was thinking about when he was presenting about this is there's the entire purpose of like securing your front door, right? Like making sure like the ne'er-do-wells do not come inside my house, but you also have to protect your patients as well. So if you think like from Luma, from our own cybersecurity posture, like our team's job, our InfoSec team's job is to not only protect like Luma as like corporate infrastructure, which protects patient data, but it's also to protect our customers' data as well, because we're custodians of that. So Nick Lees, who's our head of information security and compliance, is doing a Digital Health on Air episode with Brent Williams, who was the Chief Information Security Officer, CISO of SurveyMonkey. I have a SurveyMonkey hat right here. To talk, and it's a great episode. I encourage everyone to tune in about just like the practical nature of like securing healthcare data. the likes of Extension, Change Healthcare, Phreesia, these aren't small organizations. They're publicly traded, entities. Ascension would be if they could be. And with all the budget to be available, they still have challenges. And I think there's a great line in cybersecurity: you've been hacked, you just don't know it yet. And I think that's one of those things that we see now, like actually happening in the wild. I think, Adnan, you're right. Like MGM, we see that. You see the cybersecurity event, you get the posters. I got one from Ford or something like that, or like for a prior resident in my house. I'm like, oh no, it's AT&T. Sorry. It's like, we were part of a cyber breach. Your social might have been disclosed. I was like, that's not great. But like healthcare is like having this moment too. And one of the things I hear when I talk to CIOs a lot is, when I talk to CIOs is, what are the three things that they care about? Number one is like their electronic health record. Number two is their electronic resource planning, their ERP. And number three is cyber, right? And so I think, why we're starting with this in the episode today is, that protecting that consumer and the need of the consumer. Adnan, you were talking about this a little bit, is so important, right? Like, absolutely. What is the voice of the patient? What is the protection of their data? And like, it's the contemporary, the Q2 version of digital health. This is top of mind for a lot of people.
Absolutely. Yeah, no, I think that's perfect. It's, when we think of the state of digital health, this is a top priority. Hand in hand with that, I think it was a really nice segue is it's really all about the patient and the patient as the healthcare consumer, and not now as a concept, not just as a theme, not just as like, the top of a BuzzFeed hit list, right? But everyone has really internalized like, hey, we are here, right, to deliver care to our customers and their families. And so that's a pretty big mind shift we've seen. And I think, again, patient will see you now, point solutions training to be platforms, healthcare consumerism as just a theme or concept. That's all past tense. And really what we hear day in, day out from health system leaders, delivery organizations, folks in the trenches, right, at the front lines of interacting and interfacing with the customer, with the patient. It's, hey, we have to get to, it needs to be personalized. It needs to be easy. It needs to be clear. And really people want to get to success, and whatever success means for them. Success could mean for them like it was cheap and it was easy. Success could be for them that, hey, it was close to my house. Success could be like, hey, I got to the health outcome that I was looking for. And so I think that we're seeing now really become part and parcel of not just the CIO, not just marketing, not just access, but leadership teams as a whole. They're thinking about like, how do we solve for and really think about the lifetime value of our customers as patients, and really the healthcare consumer, not just in a single interaction, in a set of interactions, but across their entire healthcare journey.
And I think that takes us really nicely to the second kind of topic we wanted to cover, which is consumerism. You're right, that consumer, the patient is a consumer, the consumer is a patient, and how they approach the services is really the same. And one of the things we've seen, is a lot of consumer grade organizations, Walmart Health, Optum, deciding to say like, take the shingle off, like the doctor will not see you now. We're actually shutting our door down. That concept of like helping just be consumer friendly, like, what's that adage? Like every American is within a 30-minute drive of a Walmart, or 90% of Americans. It's just not enough anymore, right? It's not sufficient to be able to build a successful healthcare delivery organization. And I think a lot about that, like what is successful in like the innovation ecosystem right now, like that isn't. And what, is, or maybe is some of these like very precise, like just disease specific sort of things, but becoming part of a larger platform. It's kind of exactly what you were saying.
Yeah, no, I think if we think of the state of digital health, right, it's the digital health has grown up, right? It's not what it was 10 years ago where it was a lot.
In fact, I think definitionally what is digital health is changing.
Absolutely, right? It was like, hey, there's pain points, there's technology, we use technology to solve pain points. And I think now it's far more of a, hey, what is going to deliver impact at scale? What is, a true platform, not people pretending to be platforms, and tools are insufficient. But really, how do we think of like lasting, repeatable value for a healthcare consumer, right? And a healthcare consumer is going to be in a different mindset, wanting different things at different points in their life and their family's life.
Yeah. And I think like you look at some systems who offer both like ambulatory, primary care and, ambulatory specialized care, but also a hospital attached. A lot of the challenge around like knitting together and stitching together a unified experience really helps like how you drive that, lifetime value of the patient. And, that's a very marketing oriented word. And I think we don't use it in healthcare, maybe not even enough. That's, we definitely don't use it a ton, but maybe we don't use it enough, because I think what I see a lot of successful deployments of consumerized experiences, something like a Northfield Hospital in Minnesota, like really trying to understand the patient or the moment they want care, which is like they're going to the urgent care, seeing a wait time estimate, showing up, getting in line, and landing for care, or choosing a better care option, but they know that the health system was a good custodian of them, right? And they come back for follow-up services at some point. So I think like understanding and starting to get our minds around like lifetime value around the patient and how we can apply a platform-based approach to help navigate them across that care journey. I think, seeing Walmart kind of go the way of the dodo, Walmart Health go the way of the dodo. I don't think Walmart themselves, Bentonville wouldn't fall off the earth then. No, but like seeing Walmart Health like go the way of the dodo, I think like it becomes really important to understand like that experience. Like it can't just be one part of the patient's story.
Absolutely. Absolutely. Yeah, look, and I think we've talked a lot about how the definition of digital health has changed, how it's expanded, how it's evolved, how it's grown up. One thing that hasn't changed, right? And I go back to 10 years ago when we decided to launch a smart wait list is access, right? It's like you can't think of the customer lifetime value. You can't think of delivering lasting, repeatable value to the healthcare consumer unless you can actually ensure they get in the first place, right?
Yeah.
So the very start of the journey, which is access, and that's still really, really hard. And I know that you think about this all day, every day, right? In terms of like our founding mission, which was needing care can be hard, getting health
care shouldn't be. Yeah. I mean, if you're, it's funny, like you think about like the business of healthcare and like how digital health applies to it. I think like my mind starts to go to like lifetime value, all the kind of financial metrics. But like when I go to like how you actually make those things happen, exactly as you said, like access is this magic bullet or like this elixir that you have to like pour into the system. And a lot of times when we talk to health systems, they all have the same, not all, 98% of them have the same desire. I want to make it easy for my patients. I want to be less work for my staff. And I want to have almost no change in my delivery and how I do my job. It's like, well, something there is going to have to give, right? And I look at that bucket number 3, which is I don't want to really change what I do, but I want all the benefit. I want the benefit to my patient. I want the benefit to my staff. But we'll need a little bit of elbow grease to get ourselves there. And that's where, like, without that third pillar, like, you can't solve for access, right? So unless you're working with the physicians, like University Hospital, one of Luma's customers, did an incredible job to really work with their physician leadership to change the way that schedules are built to be focused on access as the primary driver. And look, they're in a very competitive market with an international brand, right? And so being able to have a differentiator around access has helped drive their business. I mean, you can see, Robert Early and Becker has mentioned all the time around kind of the successes they've had with this underlying change around making the patient be able to get access to their care.
Yeah, absolutely. I think access is still hard. The proliferation of digital tools and health systems, like implementing and putting in digital tools, be it apps, be it portals, be it messaging, be it CRM, right? Whatever version of digital tools folks have implemented, they're really stepping back and saying, okay, it hasn't moved the needle sufficiently in terms of access.
It's funny to bring this up. There was this talk this morning, just very top of mind since I was there like 4 hours ago. They were saying how much of your like care at home has actually worked. And it was almost always, we have tried a pilot, we've tried a pilot. Sure, in like one case, we got like 10 results. But like, it's been one of these things that's impossible to scale. So it's like this, like, I try a lot, but where's my yield? And so, yeah, sorry, it was just very particular, this remote patient monitoring, care at home, hospital at home sort of thing, where it's like, how do I achieve scale here at a health system level?
Yeah, and I think when we see successful health systems, be it university hospitals, be it Banner Health, be it Logan Health, all these different folks, be it a federally qualified health center like Sun River Health, what they've really nailed, and it's one, they understand their patient population, their customer base, their community. They know what their 3 to 5 year strategy is, because some of them are in growth mode, some of them are like, don't talk to me about increasing volumes. I just can barely serve who I have with the providers that I have, and somewhere in between. But they understand their customer base, understand their strategic imperatives, right? And then it's like, okay, digital tools are insufficient to help me make this leap. I really need to think about how can I deliver access at scale, and how can I ensure that workflows are being automated, not just for the healthcare consumer, but for my staff, for my providers, and everyone in the ecosystem who has to touch these things. And I think that's really where automating workflows, delivering access, and what that requires is depth of integration, right? To make that happen, we're really seeing, I think that's state of digital health is, we talk about scale and platforms and all the buzzwords that investors like to use. It really comes down to like, are you actually automating workflows? Are you delivering value for all the different stakeholders? Yeah.
Yeah. And I think if you look at like this triangle of like the participants in a health system, like in the technology side of the house, you got, people, you've got process, and you've got technology. Like these are like three legs of the stool. Like I'll tell you, as a technology person myself, the easiest one to solve for there is technology. We don't have a shortage of technology in healthcare, but people and process are always going to be the hardest thing. There's like, what's easier to go get, change the way that a, ophthalmology clinic at a large IDN works, or like deploy a new version of Epic. I'll guarantee you 10 out of 10 times that deploying the new version of Epic will be the easier thing to do. That said, helping these two that is our chart, right? The people in the process. And I think that's where, I think this, I'm going to like trip over myself saying this. I think that's where AI helps. I think that's where we can do a lot with this sort of like robotic process automation, Gen AI, LLM sort of stuff. Because these things where we can pattern match, the technology can actually have outsized returns on the processes. And so, I look a lot, we talk in our team internally here about like, how should we be involving Gen AI and how should we be using LLMs to really push the state of the art on the patient's experience. And one of the questions we've asked a lot is, how can we use it to enhance the staff's experience? And I'll tell you a really good example of how, it doesn't matter if you deploy Epic, you deploy Cerner, you deploy Meditech, you deploy Luma, you deploy any of these solutions. You want to make a change to how these products work. You want to turn a knob, change a setting. The first thing you do is open a support ticket. You open a SLG with Epic, you open a support case with Cerner, you open a task with Meditech, you open a Zendesk ticket with Luma, whatever it is. So that task comes in, it goes to, your technical support, your named accounting, whatever it is, right? They look something up, get the answer back to you, and then it's like this process of like helping liquidity in the system is like a 10-week, for a change, 6-week, 4 weeks, whatever it is. So, one of the things we've been playing with is like, could you just ask the settings? How would you like to change? Right. And that's not to anthropomorphize like, like software, but, like, how would you like this to work? And like, let the system suggest to you how these things could happen, because that's that process and people bit on the triangle, right? The technology, we're at the state now, we're in the richness of technology where these things are happening. That's where the change is actually difficult, because ultimately it's change management, right? And if you can't impact those changes, how are we going to push those cost to patient lifetime values?
Absolutely. No, like I think it's a great transition point. The state and vision of health would be incomplete if we didn't talk about AI, right? And so you started taking us there. Look, I think AI is real, right? If any technology company or any health system today isn't talking about AI, right, or actually should already be implementing versions of AI where there's value and there's a real problem statement that you can solve with the technology, as opposed to the technology looking for a problem to solve, you're already behind.
Yeah.
Right?
You know what the difference, like I think about that a lot with like blockchain. Talk about a technology looking for a problem to solve versus problems to solve where technology filled the gap.
Absolutely. And the markets, healthcare delivery organizations, healthcare decision makers they've been living the digital health journey for 15 years now, right? So they're fairly sophisticated and very astute. And so calling your product chat AI, that's not AI, right? They're not dum-dums, right? They're pretty clever. Like adding a .ai to a new product someone releases is insufficient.
For everyone listening, I did just for fun buy lumahealth.ai. So just in case you're wondering.
But, it comes down to like, there are real problems, business problems, people problems, technology problems that healthcare delivery organizations are looking to solve. And there's very clear alignment where like, this is where I can actually be very enabling. Right? We're seeing it on the clinical side, we're seeing it work incredibly well, right? When it comes to imaging, cardiac imaging, all sorts of imaging, right? Like
even like a lot of the more like really boring side of stuff, like, automating outbound phone calls for like prior auth. Like at some point there's going to be two AIs talking to each other.
Clinical process, like there's clear problems.
That gets pretty exciting to me pretty fast, because like, we always talk about, turnover for our staff, turnover for, the front office, turnover for end users. And, part of it is like, we ask them to do very monotonous work that doesn't necessarily, if you got into healthcare, you didn't get into healthcare just to like go to the Experian portal for 40 hours a week, right? So, I think like being able to produce better jobs and be able to up level our skilled workers, like I think that's an area where I think there's actually a ton of value to be done.
Absolutely. Yeah. I mean, if we come back to personalized, easy, clear, and I get to success, AI is absolutely an enabling technology there for any one of those levers.
Yeah.
Be it in the call center, be it in the revenue cycle, be it in the back office, be it in the
any part of the care delivery universe,
Absolutely.
right? Yeah.
Absolutely.
Awesome. Well, I think, we covered a whole bunch of topics today, really wide ranging thing. And, Adnan and I'll come on the show from time to time and really kind of do the state of the digital health ecosystem, digital health on air, it's in the name. And so, there's this line that used to be in healthcare, and I kind of heard it again recently, which is no margin, no mission, right? And so we're in the business of trying to make healthcare better, but we have to help healthcare like deliver a better business in order for it to be successful. And so whether it's, we're spending millions of dollars on solving a cybersecurity incident, we're investing net new dollars in artificial intelligence to help our end users have better jobs, or we're simply just trying to make a better consumerized experience, I think that is part of the state of digital healthcare today.
Absolutely. And I think the mission hasn't changed, right? Which is, how do we help more people get to more care and better care with technology, right? Because at the end of the day, we know there's just not enough providers, full stop, to meet healthcare demand of today and absolutely the healthcare demand.
Absolutely not in the future. All right.
So that's the state of digital health. It makes that happen.
And with that, that's today's episode of Digital Health on Air. We'll see you soon.
Bye, guys.
Eddie, look at you.